It is the WAVE 97.9 WHAV, and in the studio with us is Dr. Jay Schuur, who is the Chief of Emergency Medicine for Lawrence General and Holy Family Hospitals in Haverhill and Methuen. And can I call you Jay?
That would be great.
Okay. Well, thank you for joining me today. I appreciate it. And it's got to be a busy time. I bet the emergency room, and I know. Well, I don't know, but I'm assuming you're there. You've got other people to cover for you, right? You're not the only one. So
yes.
I'm assuming that they've had a lot of cases for heat-related cases last couple of days.
We've had some. I would say every time you get the heat above 90, particularly with humidity, we see more heat-related cases. And particularly early in the year, if people haven't installed their air conditioners, when folks are working outside, sports teams, we see that.
Oh, that's right, too. You got to stay hydrated, don't you?
Yes, it's really important if you're working outside, both to stay hydrated and to have times to rest and cool the body down, because if you're in the sun working, you're not going to be cooling down.
I'm kind of a sports nut, and I've noticed that soccer matches recently, they will take hydration breaks when it's really warm. Football practices, same thing for them.
It's really important, and particularly either teams that are starting to practice or individuals who aren't routinely out in the heat. It's very important that when you start doing activities out in the heat, you're acclimatizing yourself, taking those breaks.
We're talking with Dr. Jay Schuur, and he's the Chief of Emergency Medicine over at Lawrence General Hospital and Holy Family Hospital in Haverhill and Methuen. And there's a meeting. The state's going to be holding a session next week, next Wednesday, over at Northern Essex, the Hartlieb Technology Center. Why don't you tell us about that?
So that's correct. As part of our work to integrate and upgrade care across the system that now encompasses both Lawrence General and the Holy Family Hospitals and campuses, the system has applied to the state to close the inpatient facilities at the Haverhill campus and continue the emergency department care. And so that requires an application with the Department of Public Health, which has been submitted, and several public meetings. And the message as the Chief of the Emergency Department is that we are committed to continuing emergency care, emergency department care, locally here in all three campuses, at Methuen, at Haverhill, at Lawrence. And those meetings are going to allow us to answer questions that people have.
So I'm sure that you anticipate some of the questions, and the questions would be?
I think the big question people have is around emergency care. We're applying to become a satellite emergency facility. These are, in other states, often called freestanding emergency departments, and it means that it's a full-service emergency department that doesn't have inpatient hospital services on the same site. And it means the emergency department at Haverhill will continue taking ambulances, will continue to be open 24/7, staffed with experienced physicians for emergency medicine, the same technology we have now, CT scanners, ultrasounds, lab tests, and that's really the main question I think people will have is, are those services changing? And our message is we're going to be continuing those services.
So the hospital in Haverhill, anyway, they still have all the same diagnostic equipment.
So we will have the same diagnostic equipment for emergency services. We are applying to close down the inpatient beds, and that's being done because the census, the number of people who get admitted at the Haverhill campus, has been quite low for a number of years, and it makes sense in terms of providing higher quality care to co-locate that at the Methuen campus. And right now, most of the patients who get admitted from the Haverhill Emergency Department get transferred to get admitted to Methuen, so that's not a significant change.
Yeah, we've had stories about that on WHAV, and I guess there's roughly on average 8 to 10 beds are being used out of the 60 or so that are there. So yeah, that's not a great thing. So yeah, I can see that makes sense. And if somebody goes to the Haverhill emergency room, they have to go to Methuen. That's all included, right?
That's correct. It's part of the same hospital. So if they're at the Haverhill Emergency Department, and you can think about someone who might come in with abdominal pain, and in the emergency department they might be diagnosed with appendicitis, and that condition is either treated with surgery or with antibiotics, and they would get transferred to be admitted to the hospital and have an operation if necessary at the Methuen campus. And the ambulance would be part of the hospital coverage.
All right. Well, that makes an awful lot of sense there, and it's best to be efficient, isn't it?
Well, it's important. I think both changes over time, and particularly what we've seen after COVID, is there have been changes in healthcare, and we need to make sure we provide the services locally in the best way we can.
So you've been here about a year?
That's correct.
All right. Anything surprise you that when you came here that is different than what you thought it was going to be?
I'm not particularly surprised, but I think reinforced what I was told. The commitment of the community to these hospitals, Lawrence, and the two Holy Family sites. I've treated patients who have been everything from multiple generations born at the hospital to people who are new to the area but are incredibly committed to the hospitals and the care they've received.
Now, before we went on the air, you mentioned that you're an old radio veteran.
That is true. In college, I was a DJ on the college radio station, but that's been about 30 years. Well, I got you beat. But all right. Well, you got a lot of stuff that's going on, and there's we may as well mention it again. There's a job fair tomorrow, right? I don't know the exact time. You were mentioning that. We have been having job fairs because we continue to have open positions, and we're really interested in recruiting local talent to help in the hospital in all different roles.
Yeah, I'm doing this without a net, but I think it's tomorrow in the Methuen location, and from noon to 5. So there. And then you have that meeting the state has the meeting that is going to be happening on Wednesday over in Northern Essex in Haverhill, and then the hospital itself has a meeting at the library on Thursday.
That's correct, and both are really to inform the public and answer questions that people have.
All right. Well, any health-related things you can help us with, as we work our way through a muddy, humid day once again?
So I'll circle back to the heat-related issues. We talked about folks who are outside. I think the other important group are older adults, patients with chronic conditions, particularly on certain medications. It's important to make sure when it gets this hot that they have access to air conditioning. So, if you have older adults in your life, make sure to check on them because if you're inside and the temperature is above 80 degrees where you are inside, that does put you at risk, and we want to just make sure that people check on friends and relatives. Oh,
okay. I never even thought about that, above 80 degrees inside. Okay, I get that. That's very important. I keep my air conditioning up a little bit at home, but not 80 degrees. That would be a tough one. Hey, let me ask you one other thing. When you retired from radio in college, when did you decide you wanted to be a doctor?
So I didn't really decide early. I did a lot of work outdoors, leading trips, and as part of that, I trained to be an emergency medical technician, EMT, and as part of that training, we had to spend a couple of days just shadowing in the emergency department, and that was my first real experience with medicine, and it got me very interested. I didn't know I wanted to do emergency medicine at that point, but I applied to medical school and when you're in medical school, you rotate through all of the different specialties, and I sort of enjoyed all of them and ended up coming back to emergency medicine because it's a field where you get to continue treating patients with all different types of concerns and conditions.
So if somebody ended up in the emergency room and then they had to be admitted, then as the attending physician in the emergency room, you would go visit them in the hospital too?
No, we pass off our care to whichever service is most appropriate. So if it's a surgical case, it will be the surgical team and physicians. If it's a general medical case, it will be the medical doctors. But we see the patients when they come in with their initial concerns and conditions.
All right. Well, Jay, I want to thank you for joining me. Anything else you'd like to add this morning?
Thanks for the time, and I would say we're very grateful for the support of the community and want to make sure we get out the message that we're committed to maintaining high-quality care, emergency and otherwise, in Haverhill and Methuen and around Lawrence.
Well, I think it's great that the Haverhill emergency room is. I end up talking to a lot of the state lawmakers, and that's all they wanted to make sure that emergency room stays open, and other rooms in the hospital get used for other things, but the emergency room is probably the one that if anybody has to go to the hospital, that's the first one they go to, right?
Often, yes.
Yeah, and so that's important. That saves a lot of time for people in the Haverhill area, and the Methuen takes care of the Methuen area. The Lawrence facility takes care of the Lawrence area, and it all works together. All right. Well, thank you so much, Jay, and hopefully we'll see you around town. Okay.
Hopefully, just not hopefully at work.
That's true. Well, your work, not mine. You can come here anytime, but your work I'll stay away from as much as I can. Dr. Jay Schuur, the Chief of Emergency Medicine for Lawrence General Hospital and Holy Family in Haverhill and Methuen, our guest this morning here on the WHAV 97.9 WHAV.
Wake up with Win Damon weekdays from 6 to 9 a.m. on 97.9 FM WHAV.
Catch the wave, WHAV.